Piriformis syndrome can arise because of running or maybe an overwork around the buttock where you're not strong enough, so the piriformis has to work doubly hard, which can make the piriformis become tight and also weak at the same time, held in a contracted state, which can also cause buttock pain and maybe even some sciatica. So if you do think you've got Piriformis syndrome, and especially if you are getting any leg pain down the leg, it's really important to rule out a disc problem, and you should seek healthcare professional advice. If you have ruled out a disc problem and you want to work on some piriformis stretches and piriformis length, this also can be good under the guidance of a healthcare practitioner if you were to have a bad back. So, first of all, a good quality piriformis stretch. You lie yourself down, turn your toes out to 10 to 2 and turn your heels out to match. Okay? Make sure that you've got your lumbar spine in a nice central point, so you can begin by pelvic rocking, which is also quite pleasant for the lower back, and releasing it gently into the lumbar spine. And then find that point where you're going to keep your tailbone long and you're going to draw your tummy button down so that you have some core engaged. This is quite important because lots of people do piriformis stretches, but without engaging any stomach muscles. And so the piriformis stretch can sometimes become a little bit lost. So we're going to put my right ankle over to my left knee. I'm going to put my left side up and I'm going to put my hands around the back of my left knee. I'm going to push with my hand and I'm going to draw the left knee in. I'm going to pull my tummy down and reinforce that stability across the lumbar spine so that my hip and my buttock and my piriformis can't wriggle out of this stretch. And I'm going to hold that stretch roughly for 30 seconds. And then I'm going to take it down, I'm going to rest, and I will repeat. Because I'm quite flexible and I have the ability, this is somewhere where you could aim for. You're going to bring the foot round to make sure the ankle joint is over the knee so that you're not pushing your foot into a stretched inversion posture. And I'm going to put my hands around the back of that knee and I'm going to use my own elbows to push the knee wide. So as you can see, I'm quite flexible, but it's important we don't start lifting and curling the tailbone. It's important that we keep that tailbone long posture with the tummy to spine so that we isolate our hip joint better. I'm using my biceps and bending my elbows to pull the unit in, and I'm using my elbow on the right hand side to push that right knee wide and to get a better stretch. Well done. Okay, so make sure we do both sides. Put the left foot over to the right knee, hands through the back of the right thigh, and I'm going to pull that up and I'm going to use my hand. I'm going to make sure that I don't drop my waistline in either direction. I'm going to hold the centre and I'm going to bring that unit in. I'm going to stay here and breathe. And release the foot down. Again, to make it a little bit harder for that progression, I'm going to put my left ankle over to my right knee. I'm going to put my hands through my right thigh. I'm going to interlock my fingers so I've got a nice firm hold. And I'm going to use my left elbow to push my left knee out wide. I'm going to pull my shoulders back into the sockets and down to the floor so that I'm not heaving. And I'm going to reset, widen the collarbones and draw gently into that good quality posture. Holding and stretching. Breathe. And release. So that is hamstring and piriformis stretching. If you want to do more hamstring and neurological work, I have another video that shows you the hamstring and neurodynamic stretching exercises, and these are also really helpful for piriformis syndrome. I highly recommend that you do them alongside piriformis stretching.